Assalamu alaikum. Welcome and thank you for joining us today. I am Dr. Humera Chowdhary. I'm a board certified child, adolescent, and adult psychiatrist in practice in Plano and Frisco area for past 20 years. Today we are gathered here on the platform of American Muslim Women Physicians Association, commonly recognized as AMWPA. The vision of this organization is to promote health, welfare, and education of women. The mission of this organization is to improve the condition of women's health, provide the platform for Muslim women in medicine, and raise the awareness of issues regarding common community welfare. Let's start the program with a short prayer. Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta alayhim ghayril maghdubi alayhim waladdallin. Ameen. And the translation is, in the name of Allah, the All-Merciful, the Most Compassionate. Praise to be Allah, the Lord of all the worlds, the All-Merciful, the Most Compassionate, Ruler of the Day of Judgment. You alone we worship, and from you alone we seek help. Guide us to the straight path, the path of those on whom you have bestowed your grace, not of those who have incurred your wrath, nor of those who have gone astray. Ameen. This program is brought to you by AMWPA, who has always brought timely education to the community to help cope with various challenges in physical and mental health that community faces. In the past, we have had talks about different topics regarding community health, including education about COVID, suicide prevention, and other issues in physical health and mental health. Today's program was triggered by a very tragic event that happened recently in the DFW community of murder and suicide. That has left the whole community in deep sorrow and shock. Incidents of murder, suicide in families are undoubtedly tragic and complex, often involving deep emotional pain and turmoil. It's important to approach this matter with sensitivity and care. Coping with the loss and grief can be very challenging. AMWPA has gathered a panel of distinguished experts in the area of mental health. Today, our panel includes Dr. Mona Alvi, who is a board-certified child, adolescent, and adult psychiatrist, has been working for 20 years in the community. She's primarily working in the field of child and adolescent psychiatry. She's also board-certified in addiction psychiatry. Today, she will be talking on the topic of grief and loss. The next speaker will be Dr. Kiran Siddiqui, who is a board-certified child adolescent psychiatrist and board-certified adult psychiatrist. She is talking about warning signs and risk factors. Then we have Dr. Neelofar Lalani, who is a board-certified adult psychiatrist, board-certified addiction psychiatrist, and addiction medicine specialist. She's joining us today to carry on further discussion on warning signs and risk factors. We have Dr. Imran Khawaja, who is board-certified psychiatrist and sleep medicine physician. He's a faculty at University of Oklahoma, and he has published several papers and books on topic of sleep and comorbid mental health problems. He will be talking on communication, active listening, and stigma around mental health. Myself, Dr. Humera Chowdhary, I will be talking about resources and recommendations. Now I will invite, before I invite Doctor, a few housekeeping details. Please keep your mics on mute, and during the talk, if you have any questions or comments, please write them down and enter them into the chat room. We will answer as many questions as possible depending on the time. I do encourage you all to ask questions because your active participation makes the program more valuable for everyone. Now I will invite Dr. Mona Alvi to talk about grief and loss.
Assalamu alaikum, everyone. And thank you, Humera, for the nice introduction. And I'm really glad to be here tonight and very happy to be part of AMWPA. I have done several talks in the past. And today our discussion will be grief and loss. And this is a very sensitive issue. And we are going to discuss and address the issues in a very compassionate and empathic manner. The effects of loss are not only on the individuals who are directly affected by the loss, but everyone else. So let's dive into the issue of grief, which is a universal reality, which we may all be affected at some point in our lives. So Diana, if I can have my slides for the audience, please, I would appreciate that. Thank you. So my second slide is definition of grief. So let's begin with what is grief? How do we define grief? Grief is a feeling of sadness and other emotions we have when we lose something or someone who is important to us. It can happen when someone dies or when we face other big losses, like a relationship, ending or losing a job. Grief involves different feelings, and it's normal part of dealing with loss and change in life. So let's go to the next slide. It's types of grief. So I have, for the sake of simplicity, divided grief into two parts. One is normal grief and complicated grief. Grief is a natural and an expected response to a loss. Usually, the individual can return to their normal life. Now, that does not mean that we do not have the attachment to the loved one. But after certain time period, we are able to return back to our lives, still having the love for our loved ones. How do we differentiate with the complicated grief? Now, we probably all have heard about the saying that time is a healer, but in this case, that's not true. Grief becomes prolonged and it takes the shape of depression and anxiety, and the symptoms become very predominant in daily life. Now, there's a small percentage of people who are affected by this. It's probably 4% of the people. They cannot imagine their lives without their loved ones. They feel like life is meaningless. And there's an intense desire for the loved ones to be part of their lives again. They're completely in a disbelief that the loved ones are not there for them. So our next slide is stages of grief. So these stages are not in specific pattern. You can skip these stages. A person may not go through all the stages. So looking at denial is a disbelief, as the name suggests. So when someone passes away suddenly, a person may not believe that their loved one has gone away, and they may still think that they will come back. Anger is a stage where an individual might be lashing out at people, at family members, their friends. They feel like the world is just unfair. Bargaining is a stage you might have heard that people saying sometimes, what if I had taken my grandma to the hospital earlier? She might be with us today. So bargaining is a stage where people are going through guilt. And in depression, people are feeling hopeless. They feel isolated. they have physiological symptoms of depression, such as problems with sleep or having poor appetite. And finally, there's an acceptance that the loved one has gone and will never come back, and finally able to move on with our lives. Moving on to the next slide. So what can we do as a community, as friends or families? So there are a few interventions which are here. So active listening. So just what I mentioned earlier, grief is a normal process. So let them express themselves, express their feelings, express their thoughts, be there for them. So when I say that be there for them, it's not just for emotional support, but also for motivational support. So grief is a motivational state where a person is not able to carry their daily tasks, such as cooking food, childcare. So these are some of the things which they can get help from. And how can we monitor for any prolonged grief states, knowing the warning signs, and encourage them to seek any professional help when needed. Also, we can promote self-care by helping people to exercise, involve themselves into relaxation techniques, and try to come back to their normal routines as soon as possible. But just keep in mind, everyone has their own pace. It's hard to predict who is gonna grieve for what period of length. A lot of times, normally people can return back to their work after a few weeks or months, or be able to go through the process of grief, but some people may take longer than others. So being there for them, encouraging them to return to their normal life, that's something we can do as friends, family, as community, and check in with them regularly. And that we can do by calling them, paying visits to their home, and to make sure they are well. So our next slide, what are the key points which we can take home with tonight? Understanding grief, that it is a normal reaction to loss, and making an intervention is very, very critical to prevent conditions like depression, anxiety, and even tragic outcomes like suicide or violence. Recognize the warning signs of prolonged grief. Also try to recognize if someone already had a mental health condition. Seek help when it's needed. Remember, together we can make a difference in the lives of grieving people, and let them know that you are there for them in their journey of healing. Thank you. Humera, back to you. Thank you, everyone.
Thank you very much, Dr. Alvi. That was very insightful, very informative. I would like to stress on very important points that you made, that it's a normal process, grief is normal, it can happen, but the most important thing is that how do we handle it, recognize it, and how do we deal with it? We should seek help. Thank you, Dr. Alvi.
Exactly. Thank you. Thank you for having me.
Thank you. We are pleasure to have you. I would invite Dr. Kiran Siddiqui, and she's going to talk about warning signs and risk factors. Dr. Kiran Siddiqui.
Thank you, Dr. Humera. Thank you, Dr. Alvi, for talking about grief and loss and how to tackle and deal with it. We discussed grief, which can result from many different situations. It can be from the death of someone close to us, major life losses, suicides, homicides. Me and Dr. Lalani are going to be discussing the risk factors and warning signs of suicide. Diana, please go ahead and start my slides. As you can see on the slide, I'm going to elaborate a little bit on each one of them. There are many factors that increase risk of suicide. Depression and anxiety both carry a higher risk of suicides. I'll briefly be discussing depression and anxiety, some statistics about suicide, signs and symptoms of depression and anxiety, and what should the family member be paying attention to. 90% of those who die by suicide have a diagnosable illness, which can be depression, anxiety, combination of depression and anxiety. 50% of the patients who have depression also have anxiety disorder. 2/3 of patients who have anxiety have depression too. So these two disorders are very common and comorbid with each other. Substance abuse, which include alcohol, pain medication, illegal drugs. Some drugs are more easily and readily available to our young youth now, and other treatable mental disorders, which are anxiety disorder, mood disorder, bipolar disorder, etc. Next slide, please. So a little bit about suicide. US suicides rate have increased more than 25% since 1999. That's a huge, huge increase. Suicide is unfortunately the 10th leading cause of death across all age groups. It is the third leading cause of death among 10 to 14 years old, and second leading cause of death among 15 to 34 years old. Suicide rate is still the highest among older adults 85 and older, and it contributes to 22.39%. The rate of suicide is highest in middle-aged white men. In 2021, men died by suicide 39 times more than women. There are 132 suicides every day, and firearms are accounted for more than 54.64% of all suicides. That is why Dr. Lalani is going to talk about and discuss some preventive measures later on in the talk about firearms. Almost 3 times as many people die of suicide than homicide. And as we talked earlier, the impact of suicide goes beyond the actual death. For every death by suicide, there are 25 attempts which have their own emotional, physical, and psychological consequences. In 2021, there were estimated 1.7 million suicide attempts. Next page, please. So after these numbers, which I know are very alarming, I'm going to discuss the 2 most common psychiatric conditions that can lead towards depression, anxiety, and suicidal thoughts. One of them is depression. Depression is the most prevalent mental health condition in the United States. The rate is 18.5% of US adult population and 15.8% in adolescent population. So in simple terms, if you have 100 people, 18.5 people are depressed, and in adolescent, age 13 to 18, 15.8 adolescent in every 100 adolescents have depression. It's also the leading cause of disability worldwide. In 2020, 14.8 million US adults aged 18 and older had depression, and 4.1 million adolescents aged 12 to 17 have had one major depressive episodes. The rates of depression are the highest among adults 18 to 29. And as we saw in the previous slide, it is the third leading cause of death among this age population, second leading cause of death among this age population of 15 to 34 years of age. Okay. Rate of depression have been rising among adolescents in US. Greater than 1 in every 20 children aged 6 to 17 were found to have current anxiety or depression. Next slide, please. I'm going to briefly discuss signs and symptoms of depression. I think it is important to talk about them so that people are able to recognize these symptoms in people around them who might be struggling with them, so that they can bring it to their attention or bring it to the attention of the loved one or ask them to seek care. Okay. The first one is for 2 weeks period of time, persistent feeling of sad, depressed mood. And it doesn't have to be sad and just a depressed mood. It can be feeling sad, irritable, and angry. In younger adolescents, in younger children, the irritable and angry is the most important part. In my practice also and clinically, I have seen rarely a child or adolescent comes in telling me that they are feeling sad. Most of the time they are irritable and angry. Second is loss of pleasure or interest in your daily activities. They don't find anything that gives them pleasure, nothing. The things that they used to enjoy before, the things that they liked before, like reading or hobbies, they don't have any interest on those anymore. Or in losing interest in activities which kind of goes with the loss of pleasure. The other symptoms are poor concentration, changes in appetite or weight. Now, it does not necessarily have to be poor appetite or weight loss. It can be increase in appetite and weight gain also, which is actually part of the atypical depression. Feeling very tired or decreased energy. A lot of the time, a lot of our females have complaints of, I have no energy to do anything, I can't do my day-to-day things, I can barely do 1 or 2 things around the house, and then I just don't have energy to move or do anything else. Disrupted sleep, it can be increased sleep also, it can be decreased sleep, it can be difficulty going to sleep or waking up multiple times during the night, or it can be early morning awakenings. Okay, early morning awakenings can be part of what we call atypical depression also. Excessive feeling of guilt or low self-worth. It is very, very important. A lot of the time, this is totally ignored because nobody thinks about asking about it. These are the thoughts and ideas that go through patient's mind, or they ruminate about this. I had a patient once that ruminated about that she hurt her friend when she was 12 years of age, and this was a woman in her 20s, and she just could not get away from that thought. Low self-worth or self-esteem, like just don't think about themselves, that they are good, that they can't do anything better, that everything that they do is wrong, everything that they touch goes wrong. Hopelessness about the future, that is one of the other things. It is very important in children and adolescents. These children and adolescents cannot picture themselves in future. They just have no idea and no thought about what they are going to be or what they can be when they grow up. So their look into future is not there. They don't think that they are going to be alive in the future for them to be able to look for those things. And the last but not the least, which is the most important, thoughts about dying or suicide. If a person is experiencing these thoughts of dying or committing suicides or not wanting to be alive anymore or wishing that something bad would happen to them and they would be taken away, or something bad would happen to them and it is okay, these are alarming signs. When these happen, please seek help. If your child is experiencing that, please seek help. If your spouse is experiencing them, please seek help. If a person experiencing them, they should immediately consult their primary care physician or go to a psychiatrist or go to the emergency room. One of the other things that I did not put in the slide is somatic complaints. So these are like a headache or a stomach ache, or I'm feeling just tired, or I'm feeling lethargic, or I can't move, or I cannot do anything. These are very common symptoms. They can be an indicator of a person experiencing depression, sign and symptoms, along with other sign and symptoms that I have said. In itself, they might be indicative more of anxiety, but when you combine them with all these other symptoms, those should be paid attention to. Next slide, please. The next thing that I want to discuss about anxiety disorder, there is a whole plethora of anxiety disorders, as I will discuss. Unfortunately, because of the time constraint, I cannot go into details about them. However, I would like to name them at least, so that way people can realize that these disorders should not be taken lightly and these disorders should be paid attention to. Remember, I said that anxiety and depression go hand in hand a lot of the times. It is very rare for me to see a patient with depressive disorder and who does not have an anxiety disorder, or vice versa, a patient with anxiety disorder who does not have a depressive disorder. Anxiety disorder is the most common mental illness in United States. It's 19.1% of US population. Remember, we talked about 18.5% in adults in the previous slide, and we talked about 15% in adolescents. So anxiety disorder, which I have given various definition of or named them below, account for 19.1%. They are highly treatable, but only 36.9% of the people get help and receive treatment. 50% of people with anxiety disorder also have depressive disorder. And anxiety disorders include generalized anxiety disorder. And these generalized anxiety disorder is a person that is excessively worried about things, excessively worried about day-to-day things. They have a test and they are worried about that for a week before or 2 weeks before. They have to go to an event they are worried about because they are going to go there, that they are going to be anxious about it. So they are worrying about it 2 weeks, 3 weeks before. They have muscular tension. They feel tired and fatigued. They have difficulty doing day-to-day things. They have difficulty focusing, concentrating. They have difficulty with sleep. They have hard time going to sleep. This is especially true in children and adolescents. I've never seen an adolescent that have an anxiety disorder and does not and is able to go to sleep. They just tend to lie in bed and ruminate about things during the day that have happened. Second one is panic disorders or panic attacks. This is a massive feeling of anxiety that some people can feel that they are building up, and some people it comes out of a sudden, out of the blue. It has several symptoms that can start from feeling anxious as if something bad is about to happen. They have muscular tension. They can have nausea, vomiting, headache, stomach ache. They can feel their heart beating very fast. My patients tell me that they feel as if their heart is going to jump out of their chest. They have difficulty breathing. They tell me they can't catch their breath, or they have a hard time breathing. They start hyperventilating. Some people start crying. Some people have aches and pains in their hand and feet. Some people experience numbness and tingling. These symptoms can stay for about 5 minutes. Some people have told me they can stay up till about 20 to 30 minutes also. Then we have social anxiety disorder. Social anxiety disorder is people who have difficulty being in social situation. It's not just your normal anxiety about, oh, we are going to go to a big gathering and I don't know anybody over there. It's like, oh my gosh, I'm going to go to school, or I'm going to go to my aunt's house and I can't deal with it. And there are going to be people over there and they're going to expect me to talk. They are going to judge me. They are going to find faults in me. These people do anything and everything to not go to any social gatherings. And then we have various phobias, fear of heights, bugs, water, etc. Again, these are very big topics. Because of the time constraint, I can only highlight a little bit of them. Idea is to educate people and public that these anxiety disorder, depressive disorder should not be taken lightly and should be paid attention to, especially with your family members, kids, friends, etc. So that way they can get help and we can prevent further morbidity and mortality. This is the end of my talk. I would next ask Dr. Lalani, or over to you, Dr. Humera.
Thank you, Dr. Kiran Siddiqui. That was very informative, a lot of information about symptoms and signs of depression and anxiety. Really very important for family and loved ones to identify symptoms. Many times patients themselves cannot identify that this is depression and anxiety they are struggling with. So it's very important for the loved ones and caretakers to make sure that if there is any changes in their behaviors, any of these symptoms that Dr. Siddiqui mentioned could have been manifestation of depression and anxiety, and that can be the time for seeking help. Thank you very much, Dr. Kiran Siddiqui. I would invite Dr. Neelofar Lalani. She is going to elaborate further on risk factors and warning signs. Dr. Lalani.
Yeah, this is Dr. Lalani, and Assalamu alaikum. And you just heard about Dr. Siddiqui mentioning about all the illnesses, mental health illnesses, including depression, anxiety. We have to take it seriously, as Dr. Chaudhary said, because this could lead to and can be a risk factor for suicide. So that's what I'm going to talk about today, that how do you recognize your loved one is suffering and he is having serious mental illness that need immediate attention. And I'm going to talk about warning signs of suicide. What are the contributing factors and how can we prevent, how can we save our loved one life? So can you please display my slides, please? Next slide. So what are the warning signs of suicide? As Dr. Siddiqui mentioned, if you are suffering from depression, anxiety, and if you, how do you know that this person is going to be serious and he is going to do something bad to himself? So, what are the warning signs? Like you can see in your loved one, your family, your friends, if they are talking about suicide, that I'm going to kill myself. I wish I was dead. I were dead, or he is buying a gun or is stockpiling pills. Just you, I mean, those are the signs we have. These are the warning signs you have to pay immediate attention. If he's withdrawing from social contact, isolating, that means he's not talking to anybody. He kept himself in a room. He's not enjoying the activities he used to enjoy, having mood swings, like he has up and down. Sometimes he's feeling good, sometimes he's not feeling good, and preoccupied with death, dying, or violence. So he's always preoccupied that, that is the only solution. And he's feeling trapped or hopeless about a situation. Sometimes, they don't know that what to do. They feel so hopeless and their future is like nothing. And is just end of life is the only solution they think about. So those are the talk if patient is doing or your loved one is doing, we have to pay attention. And sometimes if you still have suicidal thought, if you have depression, anxiety, and on top of that you think that nothing is helping, let's use drugs or alcohol that will calm me down. But in fact the research says that during intoxication or drug use, the suicidal rate is very, very high because you are not thinking the right way. You are impulsive. Your thoughts are racing and you are not thinking about the future. So those are important things to keep in mind. And sometimes they are like eating too much, as we mentioned about the atypical depression, and they have the sleep problem. They could not sleep because of the mental illness, having anxiety, depression, or using alcohol or drugs, or they keep themselves in self-destructive behavior or impulsivity. Sometimes the self-destructive behavior, we can say, like sometimes the patient, your loved one or someone is cutting, like a minor thing, but these are the alarming sign that they can do something bad to themselves. And if they have impulsivity, they act on their thoughts very quickly. That is very, very important to recognize. If they are impulsive, I'm going to do this right now and I'm going to do. So those are the loved one or your friends or your families. They are showing impulsivity. Those are also the warning sign you have to keep in mind. And uh, giving away belongings. If your loved one or friends or whom you know, if they are giving away their belongings, the things they used to love it and they do not want anymore, those are also the warning sign. And saying goodbye to people as they won't see again. And those are the, sometimes they do the text messages, or those are not taken as seriously, because those are the signs that will lead to actual suicidal attempt. Or they are struggling with severe anxiety, depression, and sleep problem. Those are the mainly, and as I mentioned, substance use, alcohol, drugs, bipolar disorder, any kind of mental illness, if not treated, can lead to suicide. Next slide, please. So what are the contributing risk factors? The research says the person who have attempted one time suicide unsuccessful, he will do again. Those are the risk factors. So you have to be very, very careful. If somebody was not successful in the past attempt, he is the candidate who is going to be doing again. And of course, the feeling of hopeless, worthless, agitated, socially isolated, or lonely people are the risk factor for them to have the suicidal attempt. Or experiencing a stressful life event such as loss of loved one, a breakup, or financial or legal problems they could not handle, and they could not see any future. So those are also the contributing factor. Have a substance abuse problem. As I mentioned, alcohol and drug abuse can worsen thought of suicide and make you feel reckless or impulsive enough to act on your thought. So acting on your thought, your plan, your intention, how do you act is very important. Those are the signal we have to see if the person is impulsive, how bad is his impulsive thought, because impulsivity can lead to actual suicidal attempt. And have suicidal thoughts and access to firearm in your home. That is very, very important. That's why we recommend keep your firearm and animation that should be stored separately, and that should be securely put somewhere. Those are access. Like if you are struggling with depression, anxiety, or other risk factor, is very, very important that you keep your firearm in locked place. So you, once you have thought, at least you have time, to calm you down or cool you down. So I will encourage the family and friends, if they know about the person who is struggling, they should not be having firearm in their home, and that should be locked in a separate place, and it should have always check on him. And have an underlying psychiatric disorder, as I mentioned, major depression, PTSD, or bipolar. I will mention here also the trauma, any kind of trauma, childhood trauma, sexual abuse, any kind of abuse, any kind of domestic violence, anything can lead to suicidal thoughts. So we have to keep those things in mind, and have a family history. Family history is very important. If suppose one of your family member had committed suicide, or have substance abuse, or history of violence or physical or sexual abuse, those are also the contributing factors for suicide. Have a medical condition that can lead to depression and suicidal thinking, is such as chronic disease, chronic pain, or terminal illness. If your loved one or family is suffering from chronic illness, we have to keep an eye on him also, because that could be the risk factor to end his life, or do the actual suicidal attempt. The next slide, please. So how do you prevent, or what are the protective factors you can see in your loved one or your family? So if you get the treatment you need, what the treatment Dr. Siddiqui talked about, depression, anxiety, those symptoms or mental illnesses should not be taken lightly. You have to seek treatment because we have the treatment available. You can see the psychiatrist, you can see wherever you feel comfortable, talk to the therapist or community or your friends. So get the treatment. If you don't treat the underlying cause, your suicidal thoughts are likely to return. You may feel embarrassed to seek treatment for mental illness, but getting the right treatment for depression, substance abuse, or another underlying problem will make you feel better about life and help you keep safe. So that is very important. And your support network, that is very, very important. So it's hard to talk about suicidal feeling. Sometimes you feel like, oh, I don't want to talk about this kind of feeling. But your friends and family can help you. They can understand you, how you are feeling about yourself. So that is very important. The networking with your friends, your family, whoever you feel comfortable to talk. And so that is support groups. There are support groups in the community and community resources that Dr. And the end is Dr. Khwaja in the end will talk about the community resources. So you can get help from them. So feeling connected and supported can help reduce suicidal risk and create a protective environment, strong interpersonal bond. So, and employment, those are the things that you uh, protect your marriages, your employment, and have a good impulse control. Physically well-being is important, and always learn how to solve problem, how to learn the coping skills, or how to resolve the conflict. And good self-esteem. If you love yourself, then you can do something for yourself. So that is very, very important. And I will mention here about the spiritual and religious optimism. So religiously, if you are active, then it will help also to think about not to get yourself in, thinking of suicide. And engagement in enjoyable activities, that is also important. So those are the risk factor, but remember, suicidal feelings are temporary. If you feel hopeless or that life is not worth living anymore, remember that treatment can help you regain your perspective and your life will get better. Take one step at a time and do not act impulsively. Thank you very much for listening to me and paying attention. And I think I will go back to Dr. Chaudhary.
Thank you, Dr. Lalani. That was very informative. I would like to stress on a couple of points that Dr. Lalani mentioned, that, identify the risk factors. And if you see any loved one having those symptoms or indications, like other doctors have also mentioned, please seek help, take them seriously. Dr. Lalani especially stressed on what are the risks that can be leading into suicidal behaviors or violence or other acts, especially including impulsive behavior, self-harming behaviors, and drug addiction, because these things interfere with your cognitive thinking. Drugs and alcohol interfere with your cognitive thinking. You're not making rational decisions. So you're doing things impulsively and you are not making good decisions. So family and the loved ones around them should take a step and help them identify and the problem and seek help. One thing I would like to add, that many times I see in my practice that patients make suicidal threats and families do not take it seriously, or patient has overdosed on some medication in a suicide attempt, but still families sometimes don't take it seriously because they think, oh, he or she just overdosed on melatonin or something simple, so we're not going to seek help. Please don't do that, because that is kind of an alarm. Take it as a indication that they need help, because next attempt could be lethal. The mention of the guns, Dr. Lalani, was a very good idea, that yes, if you have access to guns, please keep them in a safe place. Even if you don't have any mental health issues, always guns should be kept in a safe place and not easily accessible. Store the gun and an ammunition in separate places and locked places. Thank you so much, Dr. Lalani. Our next panelist is Dr. Imran Khawaja, who is going to talk about communication, active listening, and stigma around mental health. Dr. Khawaja. Dr. Khawaja, you have to unmute yourself. Thank you.
Okay. No, thank you so much, Dr. Chowdhary. I think there's been good presentations by all the speakers. Now, we want to, my topic is more on communication, compassionate communication, why it is important to have compassionate communication when a person in the community is dealing with some stressors or some grief or some loss, why it is important to have a non-judgmental stance towards mental health or somebody who's struggling in their life. In addition to that, also to think about how we can, as a community, as human beings, break this stigma of mental health. So it is important to all of us as psychiatrists, mental health providers. A lot of times patients are opening to us because they know that we are not going to be judging them. We are going to be providing a safe psychological space for them, rather than they're coming in, they're not worried about us talking to somebody else because we are bound by the HIPAA, we are bound by the confidentiality rules. So those kind of principles can apply to the members in community, where if we see somebody or somebody comes and talks to us and confides in us that they're dealing with some stresses, that we don't judge them. We don't judge them. We make sure that we don't talk about it or talk to even our spouses about it, because if they feel that it has been talked about, then they're going to lose that confidence in us. They're going to lose that faith in us. So if we are meeting with somebody in our communities who are seeking out help, seeking help from mental health providers or even anybody, it's important that our stance is non-judgmental. There's a saying by, I think one of the authors about judgment is that if you judge somebody, you lose them and you cannot influence them. So same thing goes with our family, kids. If we start judging them, we tend to lose them. If we judge them, we can't love them. The more you judge, the less you love. Those are some of the sayings which, put importance on being non-judgmental around people who are struggling. So providing psychological support is important. Being non-judgment is very important, but keeping any communication with any community member or a friend who's seeking out help or sharing something personal about their mental health or thoughts about how they're struggling in their life needs to be confidential, obviously, unless they're sharing that they have a plan to harm themselves. Then you have to take responsibility and take some action. Now, where does the stigma comes from? Obviously, it has a lot of roots dating back to the history, the way historically mental health, patients with mental health have been treated in different cultures. But most of it comes from the judgment, because we have basic fears of, if you think about it, what are our basic fears? Our basic fear is not being loved or not being good enough or being labeled as mentally ill. So that kind of is one of the major reasons why people worry about the stigma. But since things have changed, if you look at in the US, for example, things have changed. But for ourselves, most of the Muslims, especially if you have come from other cultures, different areas, it's still conservative over there. But our job would be to make things a bit more normal, normalizing it. If somebody's talking about some issues, we want to keep it confidential, but we want to normalize it rather than make it as a pathology, because the more we normalize it, the more people are going to come out and talk about it and seek help. Now, stigma surrounding mental health has a heavy burden, and we collectively can strive to lift that burden. Our faith teaches us that life is precious. Seeking help for mental health challenge is not weakness. It is actually a brave behavior. If somebody comes out and says, I need some help, and then I need some mental health. If I'm depressed or I have anxiety or suicidal thoughts, they come out. Actually, it is instead of shushing them or telling them, no, you don't need to talk about it. If you're concerned about confidentiality, but make sure that they seek help from a professional, because seeking help is actually an act of strength rather than dealing with it by themselves or committing suicide. So what I'll say is that as a community, we should play a part, a vital part, sort of removing these fears, the stigma around mental health, judging about other people, or talking openly about other people's stressors or their life stresses. I think we should shun that and help people, to talk about mental health in a confidentiality manner, so that they can come out and seek help. And as a society, as a community, if we all sort of think about, if we judge somebody, we judge ourselves. We're not judging them. We cannot influence them. I think those kind of beliefs, those change in mental stance can really help us deal with these crises, because this is actually a crisis going on in not just in the US, but all cultures. So I'll stop here and I'll pass the mic back to Dr. Chowdhary, and thank you so much for listening.
Thank you very much, Dr. Khawaja. That was a great summarizing of stigma and the role of, how active listening, beautifully stated that we have to have compassionate listening, compassionate communication, and we have to remove this stigma. And I would rephrase what Dr. Khawaja just said, that if we judge somebody, we lose them and then they don't listen to us. So that is kind of setting a big guard, big wall that, okay, I'm going to judge you, you cannot talk to me. So we have to be non-judgmental, let people open up, let people talk about it, be receptive to let them say what they have to say, let them express, and then later on we can plan on how to help them or what to do them, what to do with them. Thank you so much, Dr. Khawaja.
Thank you.
Thank you. So now I would summarize and end. Last part is recommendations and resources. May I have my slides, Diana? So as we have talked about, our focus today is how we can prevent from some extreme tragedies from happening, suicide or homicide. So these are some of so first of all, we all learned about how to identify those symptoms, how to recognize it is depression, anxiety, is it mental health issue. It could manifest in different ways. And most important thing we have to remember is that no age, no gender, no psychosocial or socioeconomic sector or any religion is immune to these diseases. So anybody can be suffering from this disease. The most important thing is to identify them and then to seek help. So here are some of the numbers we have collected for you guys. Please note down the numbers, take a screenshot. We will leave them displayed, like National Suicide Hotline, behavioral health services. It is brief-lined in front of them also, that what do. They provide different kind of help, different kind of services. And if someone feels that these are very complicated things and you can't get access to these things, please at least go ahead, call your PCP, talk to your primary care doctor. They can even guide you what to do, where to seek help. And the purpose of today's talk is that we can prevent extreme outcomes. We can prevent the negative outcomes. So these are the resources. I would like to summarize that, what we learned today is, in summary, that we have to pay attention to how to cope with loss and grief. So in summary, we need to remember that this is normal. Loss happens, grief happens. We have to acknowledge that, we are dealing with it, we are struggling with it. The feelings are normal. We need to acknowledge and accept our emotions. We have to seek support. We can ask for from friends, family, neighbors, our religious organizations, doctors. There is help available, but we have to ask for support from our friends or family. Take care of yourself physically is a very important thing. Many times we have noticed that when you are dealing with the loss of loved one, you forget to take care of yourself. Like I have seen patients that they are struggling with diabetes, they are struggling with cancer, and then they forget to make appointments for themselves. They forget their own treatment, and that leads into more complications and more devastating effects, which again cause a lot of stress for the rest of the family as well. So please remember to take care of your own physical health. Next, I want to talk about express your emotions. It's okay to talk about your emotions. It's okay to be sad. It's okay to cry. Doesn't matter which gender, which age, what is your role in your family. You know, in stigma, language, it is used to be thought about. It is a sign of weakness to cry or be sad. Please, we need to work on not letting that affect us. It's okay. We are humans. We have emotions. Please express your emotions in a healthy way. Next thing is that express your emotions in a healthy way. Find a way to express your emotions. Like if you like drawing, sketching, music, do anything, journaling, let those emotions out, because when we do not let these emotions out, that is when extreme disastrous outcomes happen. It's kind of blow up kind of effect. Next is that be kind to yourself. Many times we are not kind to ourselves. We think we are very brave and we are very strong and we shouldn't be feeling sad and we shouldn't be crying and we should move on. That's not fair. So please be kind to yourself. Give yourself time to grieve, time to deal with the loss. It's okay to take a break. It's okay to step back and ask for help. Next, I want to talk about is that seek professional help. If you feel like your grief is going on for a long time, roughly normal grief period is kind of maybe 4 to 6 weeks. That's okay. But after that, if it is becoming longer, or if you're getting agitated and angry and you're thinking of suicidal thoughts or homicidal thoughts, or you're thinking of going and joining your loved one who you lost, these are signs that you need to ask for professional help. A big help that I have noticed, I would like to recommend, I have seen it helps a lot. Create some like rituals or some commemorator of your loved one. Some patients I have seen, they plant a tree in the memory of their loved ones. And that is a huge, healing. It has a huge healing power. Some people start an activity which their loved ones loved to do. So think of doing those kind of things. So remember, again, I will summarize and end with the comment that remember, healing is a process. Healing from loss takes time. It's a normal process. Grief is a normal thing. You need to give yourself time to deal with it, express yourself, and ask for help. And everybody deals with the grief in their own way. There is no one recipe, like Dr. Alvi has mentioned those stages, but everybody goes through those stages in a different way. Some people skip certain stages, so everybody deal with the grief in their own way. Thank you very much. It was very productive session. I want to thank all the speakers again for taking the time out, talking about this important subject. Our efforts are to prevent any negative outcomes from happening. And now we will open the floor for questions. People have been posting questions. I will read those questions and ask the panelists to answer those questions. Thank you very much. And I want to make a comment. There are lots of people asking about the talk. This talk is being recorded and it would be available. I think it's in the message that the website, we will post it again. You can reach it on AMWPA website. and you can access these lectures on YouTube as well. So here is a question. Somebody is asking that, what if you are concerned about a friend and family member about their mental health? What should I do? Can maybe Dr. Alvi, you want to take that question? Dr. Alvi, you have to unmute yourself.
Yes. Well, thank you for the question. So, of course, I would need more details on that. But if somebody is really concerned about their friend, of course, I want to know, what is their relationship, how much they can, if the friend is really talking to them, or is the family members are trying to, talk to the person. And if there's any kind of communication going on, sometimes it really helps with people when you share your own experiences or share the experiences in a third place. And, just like Dr. Khawaja has mentioned, that effective communication and, those walls we create for the stigma, we have to bring those walls down. So trying to really understand what's going in that person's mind, why are they not willing to share any kind of experiences, or why are they not willing to talk about their depression or anxiety or whatever their concerns are? They need to open up about them and try to understand what's behind that. Is it what they are thinking about weaknesses? Is that a weakness? So of course, a lot of times people don't talk about their feelings, then we are left with the observations. So I would definitely keep a very close eye on that loved one. I will continue to monitor them. And if at any time we have to really, of course, there are numbers available, the hotline numbers are available. If at any time of emergency you have to call, but in the meantime, finding a support person, whoever that person can find it, would be very, very helpful.
Thank you, Dr. Alvi. That was very informative. Thank you for taking that question. There is another question, and I think Dr. Khawaja can take that question. The question is that, isn't it that talking about suicide makes it worse?
So actually, the research tells us the other way around. So talking about suicide does not make people get worse or thinking about suicide. So people have this ideas that if we talk to our kids or our family members about suicide, we will implant that idea into their head. Well, I mean, in this day and age, there is no shortage of any information. So we are not going to be implanting any ideas. I mean, if there's some concern, talking about suicide will bring more awareness to us that somebody is at risk. So talking about suicide does not make things worse in any way.
Okay, thank you. And there is another question in here that all the antidepressants have the warning sign of causing suicide. Is that why the suicide risk is getting higher? Dr. Khawaja, you want to take that question too?
So I think there were some warnings by the FDA. There have been more meta-analysis which have come out. But in general, when they've gone back and looked at the studies and meta-analysis, antidepressants don't necessarily increase the risk of actual suicide. And I think since this is more an issue in younger population, especially child and adolescent, I think some of the child and adolescent psychiatrists on panel maybe want to shed some light on that as well.
Mm-hmm. So, Dr. Alvi, you want to add some comment on that subject?
And so there is a warning by the FDA on these medications, antidepressant medications, for the increase in suicidal ideation. So this warning came out in very early 2000s based on suicidal thoughts. And in these studies, really the risk was very, very small compared to the benefits which we have seen in long term. So what we really want to tell parents, any medication is used on risk versus benefits. So we have seen more benefits with these medications. When we are using these medications, we want to monitor the kids and adolescents and actually early young folks in the first few months of treatment very closely. So the parents are going to be monitoring them. They are going in regular therapy as well as being monitored by the psychiatrists.
So the risk is there, but the benefit outweighs the risk, like many medications. So we should not hesitate from using these medications. And while they are prescribed those medications, the patients are monitored very closely by the psychiatrists and the family. Thank you. Thank you very much. There is another question. Dr. Siddiqui, maybe you can take that question. How do I know when do I need to seek help? When is the time that I start to talk about seeing a therapist?
So remember in my talk, we talked about depression and anxiety. So I outlined the symptoms of depression. So persistently 2 weeks of sad, depressed, irritable mood. If you're already at the point that you are thinking that you need help, then you should start off with a therapist or start off with a psychiatrist. Sometimes psychiatrists can have long wait time. I always recommend patients that they should start off with their primary care physicians. I work with primary care physicians and pediatricians in my community a lot. They call me, tell me what's going on, what can they start patient on, or what to do. And I always tell them start if they are to the point that their depression, anxiety, or any other mental illness is affecting their day-to-day functioning. That's the red line. You need to start them on medication. If somebody is not wanting to, at least engage them with a therapist. There are many therapists in our community. They can also, if they have insurance, they can also go to their insurance websites, look at the therapists that are covered by their insurance in the area, so they can kind of decrease the lag time of finding somebody and then them telling them that they don't accept their insurance. So they have to start from somewhere. So
Sure.
whichever is the first available, talk to your primary care physician. I have lots of children and adolescents that come to me that, you know, the pediatrician that I work in community with have already started or antidepressant medication or anti-anxiety medication, and then I take over their care when they are able to come and see me.
Perfect. Thank you so much, Dr. Siddiqui. There is another question about patient not going to psychiatrist due to stigma, and what should the family do? Who wants to take that question? Dr. Lalani, you want to take that question, please?
Okay, so as we are talking about the stigma, if can you repeat the question? Were the patient suicidal or uh,
I
Dr.
think the question is more generic, that they need help, but they're not going to psychiatrist. And you can even elaborate further, if it is depression, or what if they are suicidal, then what should they do?
Yeah. So I mean, if they don't, if they do not want to go to the psychiatrist or do not get help, at least talk to them and find out what's the reason, what he is scared of, the psychiatrist or seeing somebody. I think we have to find out a loved one or parents or family or friends to know what is the reason he doesn't want to go to the psychiatrist. And sometimes they have the stigma of, you know, if I will say something, my name will be in the mental health, I have taken mental health medication or this and that. But it's better to get the help before the things are out of your hand. That's what I would recommend. First line of treatment should be the family, friends, and the loved ones who can talk to them and make them comfortable and see how severe is their illness. Do they need immediate attention? Or I mean, those are the things that's why the communication is very important. And now, since the mental health is the prime priority, and I think is now very important for every one of us to think about the mental health besides thinking about all the other medical illness, because this can lead to deadly consequences. So that is very important. That's what I would say.
Mm-hmm. Thank you, Dr. Lalani. So in summary, what I would like to say is that, it's very important to acknowledge and identify the problem. I always tell my patients that once you identify the problem, then we can come up with the solution. So please do not be in denial, recognize the symptoms, acknowledge it, and then seek help. So if we stay in denial, nobody can help us. So I want to add a few more things that just came to my mind, that with the families with loss and grief, there should be some, there are all these resources are very helpful, which we have listed. I'm not reading them because you will have access to those. So I just want to give some ideas, like, if we have lost someone, I would like our community to develop some system that there should be somebody visiting that family regularly. That family should be visited, maybe provide some meals. Sometimes what happens is that we all are very, empathic and very supportive. We go there for 2-3 days, maybe a few days, and after that, we all get busy in our lives. So I would like to make some suggestion to local community that we develop some system like that, that we have, especially when somebody's young child dies. Like a young child's loss is very, very traumatic for a family. A young unexpected death is always traumatic and very disturbing for a family. All the losses are sad, but let's say if a parent who was 80 or 90 years old and they die, their loss might not be that traumatic. They were already struggling with their disease or health issues, but as compared to a 10-12-year-old child or a young, family supporter. So we need to have some community systems developed. I would also like to advise, like, local religious organizations, maybe they can have some support systems. I would like to have some groups. Let's say if somebody has lost some loved one, let's say somebody lost a child, there should be a platform, a place where those people can come and talk about their experience, and also that would help them to cope with their loss, and that would help others who has lost their loved one. So kind of in a group setting, group therapy helps in these kind of situations. I would also like to help, and maybe we can further think about it, that our local religious organizations like local masjids should have some platform like group therapy where people can go and express themselves and get the support, not only about death and loss, any like traumatic event in life. Let's say there should be a support system for people who lost their family member. There should be a support system for people who are going through divorce or violence or trauma. So just my thoughts. So I think if anybody has any comment to add from my panelists, please do so. Otherwise, I feel like we have covered almost very good aspects of mental health and gave good ideas for identifying and preventing disastrous outcomes. Anybody has any comments to add? Please feel free to add whatever we have missed or it's important to add.
I would like to share something.
Yes, Dr. Siddiqui.
So I think when Dr. Khawaja had talked about the stigma and everything, it's so important that we educate our people, we educate patients, even in the primary care setting, even in the counseling sessions. Nobody has any hesitation in getting their diabetes, high blood pressure, or heart disease treated, but everybody has their opinion on treating any type of mental health issues. So they tell you all sorts of things. I think discussion, talk, that we are doing right now, and outreach to the community is very important to educate them that they need to take care of their mental well-being and their depression just like they take care of any other medical illnesses.
Thank you, Dr. Siddiqui. Dr. Khawaja, would you like to add some closing comments?
Yes, of course. So I would second that, because the thing is, My philosophy is being non-judgmental towards anybody. I mean, so I think this goes a long way in this particular case, especially people who are going through mental health issues or general stresses in life. Just have an approach of being compassionate. Whoever we communicate with, get in touch with. We have to be kind. That's a prophet says you have to be kind. Kindness is the way to go. And the more kind we are, we can't be kind if we are not non-judgmental. So that's the message. I mean, be non-judgmental, be kind, be compassionate, and people are going to be opening up to you a bit more, and you can help them more. So spread this message. I think that's the way to go.
Beautifully said. Thank you, Dr. Khawaja. And that's absolutely correct that our religion also advises us, educates us to be not judgmental. It's not to us to judge anyone. And it's very humbling being in this profession. We have learned that and we practice that. So I would advise everyone, like Dr. Khawaja said. Thank you, Dr. Khawaja. Dr. Lalani, you want to add some closing comments?
Yeah, I would also say the same thing. Be non-judgmental, remove the stigma of mental health, get help, communicate, get help from resources. Any network available, please get help, all the resources. That's what I would say.
Thank you, Dr. Lalani. Dr. Alvi, you want to add some closing comments? Dr. Alvi, I think you have to unmute yourself.
Okay, can you hear me now?
Yes.
Oh, okay. Okay. Well, my final comments would be that I would really like to thank AMW PA that they have brought us here for the same reason we all have to spread awareness for the mental health and, stop the stigma which is associated with it. So hopefully with all the efforts, we are going to achieve our goal. So thank you for everyone to be here tonight.
Thank you, Dr. Alvi, and thank you, AMWPA. Great effort. We are all here on the platform of AMWPA. And I would also make a closing comment that there are lots of help available beside these resources. Some of the local mosques do have mental health clinics. It is just the biggest step to take is reaching out. Please seek out help. Seek out for help. I cannot stress enough on that. Thank you so much. Thank you, Dr. Alvi. Thank you, Dr. Khawaja. Thank you, Dr. Lalani. Thank you, Dr. Siddiqui, taking time out of your busy schedules and being here with us. Thank you so much.
Thank you. Thank you.
Just one last announcement.
Yes.
This talk has been recorded, and in the next 24 hours, it will be available on AMWPA's YouTube channel. Go to YouTube and type in amwpa.org. Inshallah, you should be able to find it from tomorrow onwards.
Thank you very much. May Allah help us and guide us to keep everybody safe.
Thank you.
Thank you.
Thank you.